Hi everybody, I hope you enjoyed your lunch and managed to do a bit of networking and drop into the expo as well. I must say this morning I was really blown away by the poster presentations. I dipped in and out of them, and just incredible the number and variety. And I thought the Q&As went really well. And just plugging feedback, I don't think you've got a link yet to your feedback form, but you will get that shortly, and it'd be great to have feedback on what your experience was like. Right, I'm now going to welcome our after lunch speaker, Dr. Megan Peng, who is the QI lead for the Royal College of Paediatrics and Child Health Diabetes Collaboration. She's coordinated the dissemination of the Situational Awareness for Everyone program, that's the SAFE program. And she's a key member of the National Children and Young People's Diabetes Quality Program team. Now they've successfully delivered on the Diabetes QI Collaborative, which is now entering its 10th wave. And 70 teams have gone through the collaborative so far, with over 800 healthcare professionals undergoing a 9-month course of formal QI training. The collaborative has then extended into the Epilepsy QI Collaborative in 2019, and more recently a new national online QI hub for paediatrics has been launched. So Megan's going to talk to us about the challenge and opportunity of designing and delivering a national QI collaborative. Megan, the floor is yours.
Thank you very much. Hello, everybody, and thank you for this opportunity to speak to you all. I hope you're safe and well wherever you are. So today I'm going to speak a little bit about the journey of the collaboratives at the Royal College of Paediatrics and Child Health. I joined the college in 2018 from paediatric specialty training, and at that time we were talking about a pilot diabetes QI collaborative. So like many fantastic quality improvement work, we took inspiration from other peers around the world. And what you see on the slide at the moment is the median HbA1c for children and young people in Sweden over 2 decades. And as you can see, the median HbA1c had a significant drop in 2010 to 2012. And what's marked on the graph as Start IQ1 and Start IQ2 was their national quality improvement collaborative that they ran with 50 units across Sweden. So the team at the Royal College went over and met the team in Sweden to find out what they did and to find out how they did it. And as you can see, not only their median HbA1c, but their proportion of children who were achieving much better HbA1c levels, particularly those below 52, had increased significantly over the last 10 years or so. Our picture, so the picture in England and Wales, the National Paediatric Diabetes Audit, picture what it was in 2010 in Sweden. So our median HbA1c was staying steady. There was incremental improvement year on over the last 10 years, but then we started to really plateau. In 2015 to 2018, the median HbA1c in England and Wales stood kind of steady at 64, but there wasn't any incremental improvement. And so at that point, the team that went to visit the Swedish organisers wanted to instill and stimulate improvement on a national level here in England and Wales. And that's when we started piloting the Diabetes QI program. So in 2017, we started a pilot with 10 teams, and it was a event that started everything off. And Tricia Woodhead was the QI trainer, and it was a multidisciplinary team training event. So the whole diabetes team attended the weekend together and went on a QI journey together. That QI journey took 9 months, so there were 2 further face-to-face events 3 months apart, and then a final celebratory weekend residential 9 months later, where everyone were able to share their work and celebrate their improvement. So as you can see, our England and Wales proportion of HbA1cs was staying steady, and there wasn't much improvement over the last few years. And the idea is that we improve the median HbA1c, but also improve the proportion of children who are achieving much better HbA1cs across the board. And I think Amanda's got a poll running at the moment. So for one of the questions we asked our teams at the Diabetes QI Collaborative event, what makes you change your clinical practice? So what is the thing that has changed your clinical practice in the past? So think of a time when something's happened, or you've read about something that made you change your practice. And you've got 4 options there. So whether you change your practice after reading about something, whether you've changed your practice after benchmarking yourself against other services, whether you've changed your practice after seeing an adverse event occur to somebody else, or whether you changed your practice after an adverse event happened within your own team or within your own experience. And we asked that question really because never events sometimes actually become always events in order for change to happen. And one of the ideas that we wanted was to bring teams together across England and Wales, so teams that wouldn't necessarily speak to each other during their regional network meetings, to learn from each other and to speak to each other and share their experiences, so that we don't have to change our practice when something happens to us or something happens to one of the patients, that we change ahead of that and we learn from each other. And that was really what the MDT QI Collaborative was. So the entire multidisciplinary team goes on this 9-month course together, and they learn QI together. And it's been challenging. A lot of the time, it's very difficult to strike a balance when you are learning as a multi-professional team as to how you learn and how best to learn. People learn in many different ways. With the feedback that we still continue to get from teams, it's too didactic or not enough didactic features, it's too much jargon or not enough QI information. So it's quite hard to strike that balance when you're teaching QI to multi-professional teams. But actually the experience of learning QI together enabled the teams to be much more cohesive and much more coordinated in their quality improvement work. And the overwhelming suggestions that we get from feedback from everyone after each event is that there's just not enough time to speak to their team. We want more time as a team together and more team working. So that's instigated this wider QI Collaborative program. So the pilot started in 2017 with 10 teams, and then we rolled out to further waves, and now we're entering the 9th and 10th wave. We've got over 80 teams participating on the collaborative, and also some of our original pilot team champions have now started to become trainers themselves and teach at further waves. So we teach tools, very simple introduction to process mapping, driver diagrams, fishbone analysis, but the idea is that you do this together as a team. So you compile these tools together and you work through the process of quality improvement or planning quality improvement together as a team, and everyone has a valid voice within that planning stage. We also start talking about QI methodology. So we talk about run charts and tracking your improvement and making sure that a change is an improvement. We talk about purpose and having a unified purpose across the team. We also introduce at the second training event, so 4 months into the 9-month program, an introduction to engagement, so children and young people engagement skills. And in particular, what's become very popular is passive voting. So you see some photos of that on the slide I've got here. And it's a chance for families and children and young people to vote on what their priorities or what they want the team's priorities for improvement to be, with pasta shells in clinic waiting rooms. And that's become very popular. We also encourage teams to really engage with their families and children and young people at the start of their planning stage. So you'll see on the slide an example of a YouTube video which was created by one of the families in Sunderland, and it was an instructional or educational video that the family recorded themselves at home, that became central to the quality improvement work of that team their program. And also in the top right corner, you'll see a reconfigured clinic environment. So you'll see that the young person sits where the doctor sits or normally sits, and he directs the course of the clinic appointment, and he shows the consultant, this is in Cardiff, his downloads and directs the direction of that clinic himself. So at the end of the 9-month course, we ask each team to produce a poster to talk about their journey. And I think a great opportunity for everyone to really celebrate what they've done, look back on what they've done, and often it's a huge amount of work that's been done alongside business as usual over 9 months. But the posters also enable everybody within that team to really flex their muscles around presenting on quality improvement and sharing their quality improvement work. So it's been fantastic to see these posters become submitted abstracts and poster presentations nationally, but also at other conferences. So from the Diabetes Quality Improvement Collaborative, it's been 2-3 years now, and obviously, as mentioned before, we branched out into epilepsy. So the Epilepsy Quality Improvement Program was started and created last year, and we had our celebratory virtual event very recently on the Open UK conference. We've been able to see diabetes teams and now our epilepsy teams start to present at international conferences, and it was great to see at the international conference in Boston last year an example of a pilot Diabetes QI Collaborative in Norway, and they are starting to develop one in America as well. So this all happened pre-COVID, and I think a lot of the talks and discussions will be divided into pre-COVID and post-COVID. I just wanted to ask everyone, and I think Amanda's got the next poll up and running, how did you used to learn from others and share experiences before the time of COVID? So you've got 4 options there: annual conferences, through publications and journals, meetings with other professional networks and peers, or just informal conversations among peers. And with the collaboratives, the program was based on 4 face-to-face events. And obviously, since COVID, that's changed completely, and we've gone straight into a fully virtual collaborative. But I just wanted to touch upon what has happened with paediatrics over the last few months, and how that's impacted on the way we think about collaboratives and the way we think about quality improvement at college. So since COVID has impacted across the health service, we've seen a massive influx of information and of resources around quality improvement as teams start to cope with the crisis as things plan out. And obviously there's a lot of information out there, and we started a COVID-19 news stream on our new quality improvement hub just to kind of introduce and signpost to new resources that are coming out every single day during that period. And Paediatrics was affected quite significantly. So in the first surge, around about 1/5 of the paediatric workforce were redeployed to adult services. And we saw a huge amount of quick, rapid QI work taking place. So things like cluster clinics and paediatric hubs, in Bradford and the Healthier Together platform in Wessex, a complete reconfiguration of paediatric services and paediatric care within a matter of days. So we were able to reflect that as much as we could, and we've seen a lot over the last few months, in particular virtual consultations, and I think that's across the board from all healthcare services. The direct GP or paramedic to consultant interface, which is now hopefully going to continue and be sustained and be something that we take into business as usual in a post-COVID world, and the complete service redevelopment and reconfiguration in order to work within COVID pathways for children and young people. And we've seen a lot, and I think the concentration at the moment is around integrated care, and we saw that with our collaboratives. So when we talk about a multidisciplinary team, we we talk about the wider team, and it's not just the nurses and specialist nurses and the allied health professionals, but it's also the administrators, general managers, the commissioners, and now even expanding even further to the GP leads, representatives from NHS 111, the local paramedic service. And so quality improvement as a team has now expanded exponentially, and we're looking at integrated care in particular with the Facing the Future standards and new integrated care hubs in the works in preparation for winter pressures. But we've seen that it's a village to raise a child. It really does take a village and more to care for a child. Especially with COVID-19 and the impact it has on children and young people. So given that, I just wanted to run a final poll and ask you, how do you learn from others and share experience now that we are in a world of COVID-19? And it's the same answers, so annual conferences, or through journals, or within professional networks and organizations, or informal conversations among. And really, I wanted to ask this poll because even though we are isolated and even though we are locked down, we are more connected in many ways than ever. And essentially, our collaboratives were just a way to bring people together, for them to go on a journey together and learn about quality improvement together. That can be done in lots of different ways. And actually, we're finding with the virtual collaboratives, it doesn't have to be done by an overarching Royal College or an overarching organisation. Many people will be part of a professional network. Many people will have professional network meetings. And it's thinking about how we use that now and the way that we are able to reach out to each other through this virtual platform, how we share our work and how we listen to each other, but also how we learn together, and whether we can look at the time we have together as professionals in different specialties, and whether we can reconfigure it in a new world to learn and open up the learning opportunity. And there's lots of literature and lots of models out there to look at how we don't waste what we've learned, and we sustain some of the good changes and positive changes that we've seen. And one of the main our collectives now from teams is never waste a crisis, and I don't think we will. I think this whole new way of working, the different relationships we've built across the different health sectors and across primary, secondary and tertiary care will be sustained if we keep that momentum and we continue to learn together and we continue to keep in touch with each other. And so I just wanted to end on this. The paediatrics was affected quite significantly during the first surge, and children, young people were inadvertently affected as well. But actually the overwhelming feeling across the workforce is togetherness. And we need to keep that togetherness, particularly as we go into very difficult winter months. And I just have a link there for our QR Central hub. So all of the work, all of the posters, and more information about our collaboratives is all on our new QI Central hub. So do have a look if you get a chance. And I'm happy to take some questions.
Megan, thank you very much indeed for a very practical talk. And it's very exciting that it's all gone international as well. So it's a good time for you, reaching out internationally, virtually internationally.
Yeah, I think so. And I think it's fantastic to be able to, I think we hear a lot from teams that, oh, you know, why would we put an abstract in, or why would they be interested in a small DGH like us? But actually, there's no such thing as a small quality improvement project, and no such thing as a small improvement. And actually, we can all learn from each other. And it's fantastic to empower teams to feel like that they are doing quality improvement work and they're leading from the front, and they're able to share their work on an international scale, and it's valid.
Are you personally involved in all three? What are now all three collaboratives?
So I pass the mantle now on to Matt, my colleague, who's now leading on the Diabetes Quality Improvement Collaborative with Tricia. And so he is taking that on to the next phase, which is the fully virtual collaboratives. The epilepsy one I've been supporting, and we are looking at the next wave starting next year potentially. But the QI Central is one that I'm fully involved in, and hoping that it will inspire more collaboratives, but not necessarily collaboratives that we run, collaboratives that are homegrown or organic from different specialty groups or professional organizations, that they feel that they're able to have their own collaboratives and run them within their normal regional meetings.
Oh, that's exciting. You've talked about just questions about changing practice. Do you see that as being changing practice within a team rather than an individual decision?
Yes, and I think it's culture, and we talk about culture a lot, and it's that not thinking that you defer to the clinical lead or you defer to the doctor. And it's been fantastic and we joke about this at the beginning. So when you see teams, when they first start off and they go on the first training event, they kind of sit with the doctor in the middle, or the doctor kind of sits at the front, and you watch them as they have their team meetings, and it's the doctor or the clinical lead who directs it or chairs it. And when you see them 9 months later and they have their team time on the last event, it's a circle. There is no person leading it. Everyone has a voice and everyone is asked of their opinion, and it's heads together in a circle. So you see that cultural change, and I think that's something you can't necessarily put down on paper. A lot of the teams, you have to experience that together and get through that together to get to the other end.
Cultural changes in healthcare are really important, aren't they?
Yes.
Well, thank you very much, Megan. That was a really excellent talk. Thank you very much. Are you going to be staying around for the rest of the event, or have you got to leave?
Yes, I'll be around for another. I'll be around for another hour or so. So I'll try and pop into the networking area and
okay,
have
great. Well, everyone, we're just going to have a break up until 2 o'clock. And then Joe's going to join us for the next talk. So see you back here at 2 o'clock.